The Distinguished Nurse Practitioners of Virginia Award goes to those known for their clinical practice, their leadership in the community, and most of all, their highly esteemed research. And we're here with the 2021 winner, Kathleen Putnam, to find out more. So, Kathleen, you've had almost 30 years in the biz, so to speak. Tell me, some of the journeys and adventures that you've been on.
Many adventures. I graduated almost 30 years ago from what we called Medical College of Virginia in Richmond, which is VCU actually, with my master's degree as a nurse practitioner, as a women's health nurse practitioner, which is kind of unusual. So I've worked at many different private practices. I've taught nurse practitioner students. I was in charge of the Women's Health Nurse Practitioner program at Old Dominion University when I lived in the Tidewater area. I also was in the Navy Reserves for 20 years. I've been retired now for 6 years, and I miss my Navy friends dearly. That was a lot of fun. So I had clinical practice, and I also have my PhD in nursing, so I've been involved in the research piece of it and publications, and so I've had just a wonderful time. Everything I do is fun. I wouldn't be able to do it if it wasn't fun.
Absolutely, and we joked a little bit before this, you're quite the underachiever. You really have lived such an amazing life, and there's so much more to go, especially with this award, Distinguished Nurse Practitioners. So now, let's go back to the teaching part of it. Okay. What is that, pouring into future nurses of the world, what does that do for you?
Well, I just, my students give me so much more back than I'm ever able to give them. But I feel like it's so important because one day, and I used to always tell my nurse practitioner students that one day you might be taking care of me. So I need to make sure that they really know exactly what they're doing and love what they do. So it was a tremendous honor, but also a real responsibility to teach nurse practitioner students. But I really did enjoy that.
And you carried that honor and responsibility to the Navy. Tell me about how that even came across into your mind.
Well, actually, one of my dear friends joined the Navy Nurse Corps a year before I did, and she said, "Kathleen, you'll never guess what I did." So I said, wow, I've always thought Navy nurses are pretty cool and smart and on top of it. I think that's what I want to do too. So my husband and I had a discussion, and he said, go for it, whatever you want to do. So I signed my name on the line, took the oath, and before you knew it, I was in the Navy Reserves. But of course, this was during, the height of the war. So I was recalled many times and just had a great time in the Navy.
Absolutely. And, you're so soft-spoken on camera, but like you were saying, you carry a big stick. How did the Navy really kind of firm up your just passion for teaching and also performing, these procedures?
Well, I loved the Navy because I had the opportunity to have the clinical piece of it where I was able to take care of patients, but I also had a huge administrative responsibility for a couple of years. I was the the operations officer, which meant that I was responsible for a wide area from upstate New York to Norfolk, Virginia. So I had a lot of responsibility, but knowing that my superior officers had confidence in me and nominated me to do these big jobs, I thought to myself, if they think that I can do this, then I probably can. So it was a lot of fun. It was a lot of work. But I did enjoy it.
Yeah. Well, you're no stranger to random, quote unquote, nominations with this award. Tell me kind of, what it takes to get this award and what it really means for you and just the legacy that you're going to be leaving.
Well, it's really kind of the pinnacle of my career to be nominated by someone, I don't know who, but someone, one of my colleagues, and I guess I was nominated based on my clinical ability, my research contribution to the nurse practitioner profession. So someone out there had a lot of confidence in me, and it just means that, Kathleen, you you need to make sure that you live up to this award. And it makes me feel like I need to be a good role model for the nurse practitioners who are coming behind me.
Absolutely. And you were talking a little bit before this, Florence Nightingale, she's your heroine. So, for young viewers watching this who want to be just like you and win this award, what would be your advice to them?
Work hard. Work hard. Nothing comes easily. I would say work hard, study hard, read everything that you can get your hands on, pour your heart out to your patients.